Well, good morning, Chairman Miller and Ranking Member Klein and members of the committee. Thank you very much for allowing me to be here. As you know, APHA has been around for quite a while. We've been around since 1872, and I spent last evening looking at our recommendations back in 1918, the last time we had a great pandemic in our country. And interestingly enough, short of vaccine, many of our recommendations were the same. They were try to be in good health, wash your hands, cover up your nose and mouth when you cough and sneeze, and avoid being around other people that try to, where you might unfortunately infect them. Dr. Shugart and you, Mr. Chairman, talked a great deal about the data, and you have my written remarks, and I won't repeat those. But just to point out that one of the things that APHA has been talking about a lot is the importance for us to have a resilient community. And part of resiliency means that you have to have a much more comprehensive engagement in just the health and public health people in this response. Obviously, this type of an outbreak dramatically affects business, and we think that there is a huge role that paid sick leave for workers plays in really building an essential and resilient community. So let me talk first about the paid sick leave benefits for business. We think legislation like the one you have, Chairman, and others, as you mentioned, that are being talked about on the Hill today, can be a win-win for both the public health and business. And, you know, employers don't want sick people in the workplace, and sick workers don't want to be at work. But the incentives that we have today often incentivize workers to come to work, particularly when they're not well and they don't get paid for staying home. And I asked myself as I came into work today, I came in my building, so let me just walk you through what I saw. So when you walk into our building, we have a really nice building on I Street in downtown D.C., and we have a receptionist that you walk past. And then you get in an elevator with other people as you drive up to the various floors. I noticed my staff congregating around the coffee pot in a nice, relatively enclosed room, and of course some meeting in a conference room. Many of our employees are in open cubicles. I would argue that despite us being a public health association, having lots of hand sanitizer around and lots of signs, and I remember the last time I actually, like many other people, tried to tough it out and came to work when I wasn't feeling well. The workplace can very well be an incubator for a spread of infectious diseases if we don't encourage people not to come to work. So we think very strongly that paid sick leave for employees can enhance productivity, catch people before they want to come to work. See, the problem when you come to work and you send people home when they're sick is because they're incentivized to come to work and tough it out, is that they're infecting people all the way along the way as they come into the workplace. And so we think that any proposal ought to incentivize people not to come to work when they're sick, to do the right thing and stay home. Secondly, I think the paid sick leave benefits for employees and their families goes without saying. Certainly, if you have a sick loved one at home, you want to be able to stay home and take care of them. Many parents, good, caring parents, when they have to make a decision around paying the bills and paying the mortgage and a child's not too sick, we all know stories of parents sending their kids to school or to daycare only to get called in the middle of the day because the child really isn't feeling well and you've got to go pick them up. Well, in an infectious disease, that's a real problem. Paid sick leave certainly encourages people not to put themselves at risk, not put their kids at risk, not put their communities at risk, and so we certainly support that as a core principle. And then obviously paid sick leave benefits the community and consumers just simply because if you're in a business and someone is sick in that business, particularly with this kind of an infectious disease, they may often infect your customers. And the last thing you want to do, of course, is make your customers ill. So we think that legislation like this and other legislations that we have discussing like this on the Hill today actually promote the public's health and promote productivity in the workplace and we're here to support that. APHA has had a policy which supports employers to make comprehensive plans around these kinds of events, particularly contingency and emergency preparedness plans, continuity of operations plans. And the worst thing one can do, and the worst problem one has, even as a small employer, is to not be prepared for this kind of thing. I know that there's a lot of debate about what this costs small employers, but I would submit that the cost to not do this can certainly put a small employer out of business as well. With that, I'll stop. Thank you very much.